Hi, I'm Amanda Olson, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And today we're going to talk about pelvic pain and interstitial cystitis, or IC. Regardless of whether or not you have the ulcerative form or the non-ulcerative form of IC, chances are you're experiencing a lot of the common symptoms of IC, and that includes pressure when the bladder is filling, a constant urge and necessity to empty that bladder, so you're having frequent trips to the restroom. There can also be pain in the pelvic girdle itself, so around the hips, in the pubic bone area, in the genital area. This is a female model here, but this pertains to both men and women, of experiencing pain in and around the genitalia, and then pain when the bladder fills. Sometimes you can have pressure when the bowel is filling, and there can be some irregularities in bowel movements as well. And we're going to talk about some ways to mitigate some of that pain. Being mindful of what you're eating and drinking is obviously beneficial in helping to mitigate the pain associated with IC. There is no one communal diet for IC that works for everyone, but a lot of the common foods and drinks that irritate the bladder apply to most people, and that includes things like alcohol, heavy amounts of sugar, citrus or high acidity foods like tomatoes, orange juice, and then carbonated drinks like soda and some of the carbonated waters. Those tend to be irritating to a lot of people. It's obviously really important to work hand in hand with your doctor or other medical provider to help eliminate and determine which foods and drinks are the most irritating to you, and to limiting them or eliminating them entirely from your diet. Pertaining to the pain, there's a couple of different things that happen. Outside of what is happening in the bladder, there can also be pelvic floor dysfunction, so dysfunction of the muscles that support the bladder, that can ramp up the pain or make the pain worse. And oftentimes working hand in hand with a pelvic physical therapist and helping to address the pelvic floor pain can be the difference between being able to do your job and do the lifestyle activities and things that you want to do and not being able to. So once we get the pain driving from the pelvic floor muscles under control, oftentimes it becomes a lot easier to be able to do those other things. And a lot of times that helps to eliminate some of the pressure on the bladder as well. So one of the things that can happen, so this again is a female model, this does pertain to men as well. I'm going to show you the top view here of the organs, and then the bottom view here, the pelvic floor. You can see the bladder sits in the front, uterus and vagina in the middle, and the rectum back behind that. I'm going to take those organs out here. Everything you see in red here, coming from the pubic bone out to the sit bones and back to the tailbone, is muscle. So these muscles also have a deep layer here on the inside of the pelvic girdle, and they help to support the bladder and the rectum and the uterus and the vagina in women. And they can be really strong, and they can also be weak, and they can also be really tight. And one of the things that happens for a lot of people with IC is that due to the discomfort and the pain associated with what's happening in the bladder, is they will clench those pelvic floor muscles unknowingly. So you're not doing it on purpose. And it's not enough to just say relax, but those muscles become very, very tight because they're guarding against that pain, and also they are guarding to try to provide closure around the urethra, to try to stop the pain. And in turn, this becomes cyclic, and it actually ramps up and drives more pain because those muscles get very, very tight. Just the same way as if you walked around with your shoulders up here all day long, you would get a nice knot in your neck and in your shoulders, and if you pushed on it, it would hurt really bad and it could zing over your head. The same thing can happen in the pelvic floor muscles. We can develop knots inside those muscles. We can develop spasms, and those muscles can become very, very short and not very flexible. And that can in turn create issues with voiding. So, when the muscles are very, very tight, they are closing very strongly around the urethra here in the front. And if they are unable to relax, that makes it even harder to get the urine out. And then we can see things like you're sitting there on the toilet for a few minutes trying to get the urine out and it's not coming out. A lot of that is associated with muscle dysfunction. To treat that, there's a couple of different options. One of the options is using dilators. This is specific to women who have vaginal pain associated with difficulty using a tampon, difficulty having a medical exam, difficulty having penetrative sex. The dilators can be used to gently mobilize the tissue around the vagina in order to be able to withstand penetrative things like having sex or having a medical exam. The Intimate Rose dilators come in 8 different sizes, and they're coming in a really soft medical grade silicone. And so what you're doing is gently and progressively every day you are working on compressing the tissue around the vagina to get it to be more flexible and expansive, and that can help to address the restriction around the bladder itself, and you can be progressively moving up to be able to tolerate more width and more depth of the dilator. Another tool is using a wand to do some really gentle myofascial release in the areas of the pelvic floor and around the bladder. So I made these wands to be able to be ergonomic and to be able to reach actually specifically to get up and under the bladder, where a lot of those trigger points form in people with IC. So here's the pelvic floor here, and that bladder sat right in the front. You can see that there are muscles right under that bone there in the front. And the best way to reach it to do a tender point release or to do myofascial release is with this hook on this wand to come up and under right in through there, and then you can gently mobilize it coming up and down. I always recommend that you never push any harder than you would use to check a tomato for ripeness. So as you're coming in and you're using the wand, regardless of which size you're using, you could go vaginally or rectally with either end in order to reach those points. But you're never pushing any harder than you would use to check a tomato for ripeness. So we're not pushing very hard. But to get the areas under the bladder, if we imagine that this is the vagina, we're just coming in right in through here and just doing a really gentle mobilization. Oftentimes as well, there will be guarding in the sides of the muscles here, and the way that we can get to those is either by coming in and hooking off to the side like this, or using the smaller end and coming in to find that spot in the side wall there. I know that that looks really extreme, but that's generally speaking how far out those tender points can be on the side walls that can create some of that pain that radiates into the sides of the hips. You can use the wand daily. We also have one that comes with vibration. Some people respond really well to that vibration. It can increase blood flow, and it can help relax the muscles around the bladder and around the vagina and around the rectum. But for those who don't tend to like vibration, this one is still. This is the purple one, and again, it can go in the rectum. So for men, you can do this same sort of tender point release coming in through the rectum and forward towards the bladder, towards the pubic bone there, to do some really gentle release there to get some good results. I always recommend working hand in hand with a pelvic physical therapist, but if you don't have one in your area, I have over 100 different videos on different myofascial techniques and how to treat pelvic pain using breath techniques, and we're always here to answer your questions as well. For more information, contact us at support@intimaterose.com or visit our website at intimaterose.com, and you can go onto our blog and onto our videos and find other resources there.